when I go to these meetings and we meet either caregivers or family members or patients themselves, they come up and talk about symptoms being missed or signs not being picked up. How do we get the message out that there are certain clinical indications for early detection that even general practitioners should be aware of?
Patients are taking control of their own health. They're going to see different doctors, and I think that's the way, is really educating patients better. And that's what all of us have done in medical schools. Now we have this opportunity to do this on mass scale. The Pancreatic Cancer Action Network, they have that infrastructure, and I think that's the way to go.
One of the biggest challenges with pancreatic cancer is that it is still, unfortunately, a disease that presents very late for most patients, at a point when the disease is already spread beyond the organ and it's not surgically resectable. And so that's a real challenge.
We would really ideally have a test that would allow us to comprehensively examine the whole pancreas.
Yeah.
And we don't have a test like that. What we do is we do offer pancreatic screening to people who we feel the tests warranted, and that's generally based on the extent of their family history. Because we'd like to develop a blood test, we collect blood and we subject those blood tests to very active research. We take pancreatic fluid samples, trying to see, can we see early signs of disease, early signs of pancreatic cancer or precancerous changes that aren't being picked up by their imaging tests. And that's one of the goals. We'd love to be able to develop better tests that tell us exactly what's going on in the pancreas.
So why do you think it has been such a challenge to develop a clinically applicable test for pancreatic cancer detection?
That's a great question where, we want that liquid biopsy. We want to be able to go to our primary care doctor's office, get a blood test, and tell you what is my risk. But since the patient population is relatively small, at one institution, you cannot do a study that's large enough to really test that hypothesis.
Obviously, the utopian goal is to get this before it even becomes invasive, becomes cancer. Keeping in mind the Pancreatic Cancer Action Network's goal of doubling survival by 2020, in the medium term or the short term, we should be aiming for earlier detection.
Basically, the organizations recognize that for a disease like this, we have to have team science, and that's why we have collaborations. All of our early detection studies are essentially getting to be larger and larger collaborations across more and more institutions and involving larger numbers of patients and having diverse technologies, and you see what the best things that come out. If we were able to get earlier in the natural history of the disease before somebody has an invasive cancer, then we can make a major difference to the outcome of patients.
The important thing is that we all realize that we all want to root for our team. We all want, our test is going to be the test. But we have to realize that our test is part of the team.
That's right.
And I think that if we get away from trying to compare tests to each other,
right,
and more like, what if my test and your test came together? Would that be the best? And I think that's what it's going to be.
We're still on the hunt for better risk assessment tools, better predictors of your lifetime risk of developing pancreatic cancer. But now we're trying to study families, and now we're trying to follow people who have a certain increased risk long term, and gradually we learn more and more about the disease and get to the point where we can do this risk assessment much better.
I'm very excited about this diabetes and pancreatic cancer link, because I think this again
really
provides
important.
us a potential opportunity to go after the disease in terms of earlier detection in a patient subset that we would normally not recognize up front. And what excites you the most, David?
Well, I think technologies have evolved rapidly. And so we can do things that we never thought we could do 10, 15 years ago.
And do you think we are farther along today than we were when you started your lab, the first early detection lab in the country, I would say, for pancreatic cancer?
I think, yes, we are. I mean, we have many more patients enrolled in early detection studies.
Right.
We have much greater understanding of the disease than we did 15 years ago. And we have much better tools, much better tests. And so all of that adds up to significant promise.